Now that we have addressed the lumbar region with our soft tissue, we're going to be addressing a diagnosis of L3 extended rotated right side bend right. So to begin, we have our patient lie in the lateral recumbent position on his right side because that is the side of the rotated posterior transverse process. So to locate L3, we're going to be using that iliac crest, coming over to that first spinous process we feel being L4. We'll move up one segment to find L3. Now we are monitoring that L3, L4 region with our superior hand. We're going to grasp the patient's legs, and we're going to flex until we feel motion at that L3, L4 region. Okay, and go ahead and straighten your bottom leg. And we will then hook the superior leg into the popliteal fossa. Now I'm going to switch my monitoring hand, still on that L3, L4 region, and with my superior hand I'm going to be grasping the patient's elbow, and the patient will also grasp my elbow, and I will be pulling anteriorly and superiorly to induce rotation to the left and side bending to the left.
We will now view the same thing from an overhead shot. The physician contacts the L3, L4 joint space and flexes the patient's hips up into that restrictive barrier. The patient straightens the bottom leg, and the physician switches the monitoring hand. Will contact the patient's right arm and pull anteriorly, inducing left rotation, and superiorly, inducing left side bending into the restrictive barriers.
So flexed, side bent left, rotated left. We've approximated all of the restrictive barriers. Now we can go ahead and swoop my arm in between the patient's arm. My elbow and forearm will be on the anterior axillary line on the pectoral region of the patient, stabilizing and monitoring L3. My inferior hand will be monitoring L4 with my forearm and elbow on the sacroiliac region or buttock of the patient. Now that I'm in position, I can go ahead and roll the patient towards me as a unit, and I can approximate the restrictive barriers by opposing my arms. Now that I'm at the restrictive barriers, I can have the patient go ahead and take a deep breath in and all the way out. And as he exhales, I follow down and drop my body weight into the table. And I'm also providing a rotary thrust in an anterior direction with my inferior arm on the sacroiliac region. After the thrust, I'll return my patient to neutral, and I would retest. Go ahead and sit up for me. To retest, I would locate L4 by finding the iliac crest and moving to that first spinous process that I feel. I will count up to the next segment, L3, come out to those transverse processes. And those feel symmetric. Go ahead and flex forward for me. Stop right there. And come back up and look towards the ceiling. And come back to neutral. And in both flexion and extension, they still feel symmetric.